For our presentation, we decided to pick All the Bright Places. This movie depicts the struggle of a guy named Theodore Finch. This took place in a fictional town known as Bartlett, Indiana. He's never had a great relationship with his parents. His father was abusive towards him and his mother and eventually left him to start a new family. Due to the divorce, the mother ended up working 2 jobs to provide for the family. She was barely involved in Theodore's life and unaware of Theodore's struggles. We then see the relationship between him and Violet Markey, as they show how powerful mental illness has an effect on him.
The diagnosis for Theodore Finch in this movie is bipolar disorder, which is an illness characterized by recurrent episodes of depression and mania, which cause changes in a person's energy, mood, ability to function, and struggles with mood fluctuation. For instance, someone with bipolar disorder may be very happy one day and severely depressed the other. These periods can last hours or days depending on their specific circumstances. The film's cultural context is based on high school, social media, and social roles placed in high school. It's quite a coming-of-age story focused on trying to fit in amongst people who are trying to do the same. Furthermore, bipolar disorder is diagnosed in all cultures, but it is understood and treated differently in different cultures due to the environment, beliefs, and values in the disorder. Our evidence supporting the diagnosis of Theodore Finch with bipolar disorder is depressive and manic episodes. Throughout the movie, he experiences depressive episodes in which he's unresponsive, distant, and has suicidal thoughts. In fact, those with bipolar disorder are 20 to 30 times more likely to commit suicide. Towards the end of the movie, he ends up carrying out with these suicidal thoughts and plans and ends up taking his own life. Furthermore, he experiences manic episodes in which he destroys his own belongings and runs away from home. He tears down post-it notes in his room, paints over his walls, and sleeps in his closet. He also runs away for multiple days at a time without letting anyone know, including Violet Markey, and leaves his peers, friends, and loved ones very worried about him. Both depressive and manic episodes are used to diagnose bipolar disorder. Thus, that is why it is so important to attribute both of these symptoms to support our diagnosis.
There are multiple treatments for bipolar disorder, but currently it is widely accepted that the most effective treatment for bipolar is actually a combination of treatments. In Finch's particular situation, it would be recommended for him to undergo a combination of psychosocial treatment and medication treatment. Psychosocial treatment includes interpersonal and social rhythm therapy, family-focused therapy, and cognitive behavioral therapy. With interpersonal and social rhythm therapy, patients learn skills that can help to protect themselves against the development of future episodes, such as understanding what worsens and triggers their illness for them. Managing the patient's symptoms and improving interpersonal relations is the primary focus of this type of therapy. Now, in family-focused therapy, family members are taught to recognize the warning signs of either a manic or a depressive episode, as well as communication skills. This form of treatment helps the patient get back on track with the support of their family. Lastly, cognitive behavior therapy helps bipolar patients by teaching them strategies such as role-playing to get ready for interactions that can be problematic, facing fears directly rather than practicing avoidance, and learning techniques to calm and relax the body and mind. Now, medication treatment, on the other hand, relies on mood-stabilizing medications to combat the symptoms of bipolar disorder. It is best to use a combination of mood-stabilizing medications, such as in this suggested treatment plan, where a combination of lithium and lamotrigine is recommended. The reason for this is that typically different medications work better at combating either the mania or depression sides of bipolar disorder. For example, lithium has been shown to better combat the depressive episodes of bipolar, whereas lamotrigine better combats mania. Taken together, they effectively combat both sides of bipolar disorder. Ultimately, as bipolar is an illness with many contributing factors, multiple forms of treatment are needed in order to successfully combat this disorder.
We believe that this was a fairly accurate portrayal of bipolar disorder because they exaggerate the main symptoms of bipolar. For example, in this movie, he would stay awake because he wants to take control of his life and his actions. When he was extremely depressed, he would disappear and no one would know where he was. In broader terms, the portrayal of bipolar in this film influenced our understanding of this disorder because it gives us a visual of what it was like for a person to deal with bipolar. For instance, when he was experiencing mania, he would hold his breath underwater to train himself to swim across a large body of water. From this, we are able to see that he has some type of mental illness. And with his mood fluctuations, we are able to see that he has bipolar.